In this video, we will explain why we think that complementary and alternative medicines are not only ineffective, but also how they can be dangerous and detrimental to the health of patients. Complementary and alternative medicine, or CAM, is defined as diagnosis, treatment, and/or prevention, which complements mainstream medicine by contributing to a common whole by satisfying a demand not met by orthodoxy, or by diversifying the conceptual frameworks of medicine. Most common and most popular forms of CAM nowadays include herbalism, aromatherapy, homeopathy, acupuncture, massage, and reflexology.
The World Health Organization estimates that 4 billion people, 80% of the world's population, presently use alternative medicine for some aspect of primary health care. One reason people tend to use CAM so often is the low cost as compared to prescription drugs. A study conducted by DeBoss and Strauss in 2006 found that due to its cost-effective procedures and easy accessibility, CAM could reduce the cost of healthcare delivery, especially for chronic conditions such as arthritic pain and AIDS. Complementary and alternative medicines often employ a patient-centered and more individualized approach to care than does modern-day Western medicine. Lutz and Bauer study found that patient-centered care has been known to improve pain management and increase self-worth in patients. Most importantly, many CAM practitioners use intensive counseling to help patients find out which aspects of their daily lives, such as job stress, marital problems, diet or sleeping habits, might be behind their symptoms. This is a strategy often overlooked by Western medicine. Most complementary and alternative medicines are less invasive and pose less risk of injury and unwanted outcomes as a result of their use when compared with modern-day medicine. Herbs, massages, lifestyle changes, aromatherapy, and the like do not pose a severe risk of complications. Findings from Starfield's article indicated that because of clinical iatrogenic damage, there were 7,000 deaths per year from medication errors in hospitals and 106,000 deaths per year from non-error adverse effects from modern-day medicine in the United States alone.
Perhaps the most significant and well-studied critique of alternative medicine is the lack of empirical scientific evidence. A study by Tillman found that the lack of scientific evidence is the main reason why American health insurance companies rarely include alternative medicine as part of their coverage. Tillman also found that there is very little evidence showing that alternative medical treatments are indeed effective. In addition to this, several results found in the few studies that have been conducted often do not support the initial claims made by CAM practitioners. This lack of evidence is the most serious issue with CAM. All our modern-day medicines and interventions are tested thoroughly for safety and effectiveness before they are used. The same cannot be said for complementary and alternative medicines. The state of non-governmental body regulation over CAM, hence private institution, leads to several problems that can significantly affect the health of the population who use complementary and alternative medicines. CAM practitioners are granted the license of business, thereby giving them rights to own and operate a private CAM clinic. This is entirely different from the medical license with which one can practice CAM and can prove his or her competence in the field. This two-leveled licensing system and the ambiguity of how it works can both confuse and endanger the general public. Being licensed to run a business does not give you legitimacy to give medical advice, but unfortunately it is often used that way. Tillman found that many CAM practitioners obtain their credentials outside of verified universities. It is therefore extremely difficult to assess and also trust the credibility and reliability of said practitioners if there are no set standards and guidelines for their training.
Although the general risk of side effects from herbal and complementary medicines is lower, they still have various degrees of side effects, and more importantly, there is no preset regulation on the doses required to treat the symptoms. In some cases, a small amount might relieve the symptoms for some people, while it can exacerbate the symptoms for the others. In fact, acupuncture, one of the most commonly used CAMs, is also associated with a range of side effects such as transmission of infectious diseases through contaminated needles, misapplied needles, bleeding, and pain. Some CAMs are also condemned for interfering and altering the effect of other medications, ultimately threatening the lives of the patients. For example, a study conducted by Markman found that during surgery, some CAM medications would work side by side with the anesthetics and other sedatives to down-regulate blood pressure, platelet functions, and respiration. To make things worse, there is no governing body that regulates the safety of the CAN medications. Since CAN medications are often taken without the doctor's knowledge or without explicit consent from the doctor, interactions can go unnoticed until it is too late.